Hello all, my name is Nabil Abu Mahfouz and I'm speaking today about a vital challenge at the intersection of medicine and technology, algorithmic bias in medical AI systems and how we can engineer fairness into those tools from scratch. Artificial intelligence is transforming medicine from risk assessment and radiology to treatment planning and triage. But as AI becomes more integral to patient care, there's fear that it might not be as unbiased as we think. The poster title is Bias in Medical AI, Ethical and Engineering Challenges and Algorithmic Fairness, and the objectives are to one, define current research on algorithmic fairness in medical AI, particularly with respect to health disparities that occur in underrepresented groups, including those who are indigenous, immigrant, or of low socioeconomic status. Two, discuss the strengths and weaknesses of existing approaches to reducing bias in medical AI and how such initiatives impact healthcare access and outcomes equity among marginalized populations, and three, assess and analyze how AI design with sensitivity to bias can influence clinical practice and health professions education, potentially resulting in reduced disparities and improved delivery of care across diverse patient populations. No relationships with for-profit or not-for-profit organizations, and this program has not received financial or in-kind support. First, I will begin by briefly discussing the problem of bias. Most machine learning models are trained on enormous data sets that are not representative of all patient populations. Underrepresentation of certain groups, such as racial minorities, women, or patients coming from resource-limited settings, can have critical downstream implications. A notable infamous example is in dermatology. Models trained primarily on pictures of lighter skin may misdiagnose darker skinned patients. That's not a statistical artifact, it's a clinical problem that affects lives. Bias is not always a result of data. Design choices, for example, how we evaluate model performance or which variables we select, can reinforce existing inequalities. An extremely accurate model can conceal poor performance in vulnerable subgroups. Next, I will briefly touch on systemic inequality reflected in AI. So we must also recognize that AI doesn't exist in isolation. It's being trained on healthcare systems that are already unequal. Access inequities, provider biases, and even systemic distrust all factor into the data we're using. So if we're training our AI on unequal healthcare data, then we're essentially programming those same inequalities into our algorithms. Fighting AI bias means fighting these deeper systemic issues too. Next, some fairness strategies. So what do we do? First, representative data sets are critical. We need to actively bring underrepresented groups into our data through targeted sampling, stratified recruitment, or synthetic data generation. Second, we need bias-conscious training procedures like reweighing underrepresented cases, adversarial debiasing, and including fairness constraints directly in our optimization. Federal learning is another thrilling prospect. By allowing institutions to collaborate without the exchange of raw patient information, we can improve diversity in data training without sacrificing privacy. And we have to do it with explainability. Clinicians need to understand why a model is suggesting something, especially if it could influence patient care. Techniques like saliency maps and counterfactuals allow for this. Next, some ethics and oversight. But fairness is not just technical, fairness is also ethical. We need informed consent for AI-enabled care, privacy protection for patient data, and regulation to hold individuals accountable. As clinical trials must comply with diversity and safety requirements, so too must AI systems. Fairness is not a box to be checked. It's an ongoing effort. Routine auditing, clinician and patient reporting, and reactive policy measures are essential to making these systems fairer and safer in the long run. In summary, AI holds immense promise to make healthcare more effective, more efficient, and more personalized. But unless we're careful, it may reinforce the very disparities we're trying to reduce. By bringing together engineering perfection with ethical duty and industry collaboration, we can make AI work not just for medicine, but for patients everywhere. Thank you.